Oral endoscopic pyloromyotomy is efficacious and safe for refractory gastroparesis. Prospective trial with assessment of pyloric function. Introduction. Gastroparesis is a chronic functional disorder characterized by delayed gastric emptying in the absence of mechanical obstruction and a variety of other symptoms. It has a high prevalence in the United States, approximately 3%. Common etiologies of gastroparesis include diabetes and surgery. The major symptoms include nausea, vomiting, postprandial fullness, and early satiety with impaired quality of life. In patients with diabetes, gastroparesis could be responsible either for uncontrolled diabetes mellitus and/or postprandial hypoglycemia as a consequence of a significant glucose imbalance. Delayed gastric emptying has to be confirmed by scintigraphy and is defined as the percentage of the remaining radioisotope at 2 hours, %H2, greater than 60%, and at 4 hours, %H4, greater than 10%. The treatment for gastroparesis includes a specific diet, frequent small meals with low fat and fiber content, and prokinetic drugs. However, some of these drugs are associated with dangerous side effects, such as cardiac arrhythmia. Tachyphylaxis can also occur, making them ineffective. There is currently no validated therapeutic alternative if these treatments fail. The pathophysiology of gastroparesis is complex and involves antral, fundic, and pyloric motor dysfunction. Indeed, pylorospasm has been reported in some patients, and a high fasting pyloric tone has been found in almost 50% of cases. Fasting compliance is low in patients with gastroparesis and negatively correlated with gastric emptying. The procedures used to treat pyloric dysfunction, including botulinum toxin injection, surgical pyloroplasty, pyloric dilation, and transpyloric stenting, have produced promising results in open studies, but not in randomized studies. A new and simple procedure for selecting gastroparetic patients who are suitable for an endoscopic treatment that targets pyloric dysfunction is the endoscopic functional luminal imaging probe, EndoFlip, Crosspond, Galway, Ireland. Among the possible endoscopic procedures, 4 recent small retrospective studies and 1 case series have suggested the efficacy of peroral pyloromyotomy, gastric peroral endoscopic myotomy, GPOEM, for treating severe refractory gastroparesis. However, the lack of a systematic evaluation of gastric emptying, the heterogeneity of the patients and follow-up procedures, the retrospective experimental design, and the lack of consistent procedures for assessing pyloric function can only be addressed by a well-designed prospective study. The development of a new therapeutic procedure could represent an important step forward for affected patients. The aim of the current study was to evaluate the feasibility, safety, and efficacy of GPOEM in patients with refractory gastroparesis. Background. Gastroparesis is a functional disorder with a variety of symptoms that is characterized by delayed gastric emptying in the absence of mechanical obstruction. A recent series of retrospective studies has demonstrated that peroral endoscopic pyloromyotomy, GPOEM, is a promising endoscopic procedure for treating patients with refractory gastroparesis. The aim of this prospective study was to evaluate the feasibility, safety, and efficacy of GPOEM. Methods. 20 patients with refractory gastroparesis, 10 diabetic and 10 non-diabetic, were prospectively included in the trial. Patients were treated by GPOEM after evaluation of pyloric function using an endoscopic functional luminal imaging probe. Clinical responses were evaluated using the Gastroparesis Cardinal Symptom Index, GCSI, and quality of life was assessed using the Patient Assessment of Upper Gastrointestinal Disorders Quality of Life Scale and the Gastrointestinal Quality of Life Index scores. Gastric emptying was measured using 4-hour scintigraphy before GPOEM and at 3 months. Results. Feasibility of the procedure was 100%. Compared with baseline values, GPOEM significantly improved symptoms, GCSI 1.3 versus 3.5, p less than 0.001. Quality of life and gastric emptying at 3 months. The clinical success of GPOEM using the functional imaging probe, inflated to 50 milliliters, had specificity of 100% and sensitivity of 72.2%, p equals 0.04, 95% confidence interval 0.51 to 0.94, area under the curve 0.72, at a distensibility threshold of 9.2 millimeters squared per millimeter of mercury. Conclusion. GPOEM was efficacious and safe for treating refractory gastroparesis, especially in patients with low pyloric distensibility.